Welcome today. This is Jason W. Sork speaking regarding health assessment class. I'm going to be discussing today about the mental health part of the interview with the patient. It is a very vital role. I'm going to be also discussing this with my father, Lendl Sork. And basically, this is, like I said, a vital role in the regard of the care of the patient. To begin with, as with any patient, we would adhere to privacy. The door would be shut. When I would enter and approach the room, knocking on the door, I would walk in, address myself, stating that my name is Jason, and I would shake hands and speak with the client and address him as Mr. Sork. I would also be sitting more or less in a comfortable chair on an even level, and that way the client, patient, resident, however you want to describe the person, would be more comfortable. While looking at the patient, I would be looking at, is he groomed? Is his hair disheveled? Is he wearing glasses? Are the glasses clean? Are there any blemishes going on? Any scraggly beard or anything that would resemble that something, not very good hygiene or anything like that. Any body odor. Many times you can, within the first minute or so, you can see whether there is a situation going on or not. So to begin with, I introduce myself. My name is Jason. Glad to see you. I would ask underlining calls, what are you here for? We will more or less state in this interview that Mr. Sork states that this is just a general checkup. I would also address Mr. Sork, stating I'm going to be asking a few questions here on the general checkup. To begin with, I would be stating, how he's been doing or anything like that, whether he was having any problems, any headaches, anything like that. Then, just like a bait with a fish biting down on it, start to ask some questions like, Mr. Sork, what is today's date? And when you answer that, can you give me the full date, the month, the date, and the year?
November the 1st, 2013.
Okay. Probably would discuss then about any changes that's been going on, like the weather or anything. Then I would state, Mr. Sork, what day of the week is it?
This is Friday.
A lot of times in a good assessment, it is good to kind of discuss in between. I have found that, then that way you can see whether the memory is intact. For example, we discussed about the date, then we talked like, since this is November, baseball season, or whether there was a huge storm that in fact recently occurred. Then to start in to talk about the day of the week. This helps the clientele to feel more comfortable, more inapt in regard to the questionnaires. Then I would state, for the sake of my employment, we will act like this is at the place of my employment, which would be in Marion, Illinois, and I would ask, well, what is the name of this place?
It's VA Medical Center.
Okay. Sometimes you'd want specific descriptions, like, for example, other facilities might be Health South Tri-State Rehab or Ridgeway Manor Nursing Center. Some people can address, well, this is like where I'm employed, the Marion VA, and some people can actually address the street number and everything. And if they can, that is good. You need to document exactly what the clientele states. Then I would ask, how old are you, Mr. Sork?
70 years old.
Okay. On looking at that, I would also look at the history of the patient, whether the age corresponds with the date of birth. Then I would proceed with this question. When were you born?
August 28th, 1943.
And by looking at that, I could examine whether Mr. Sork is correct or whether there is a problem going on. Furthermore, what helps out, you can also check about the mental health status, whether it is short-term or long-term by asking just simple questions. For example, who is the President of the United States now?
Barack Obama.
Okay. With this question, usually the last name would only be required. But since Dad addressed this as Barack Obama, then I can state that Dad's mental health on the short-term memory is good. All right, here's another question. Who was the president before President Obama?
George W. Bush.
Okay. Okay, that is something good also. Now, I'm going to ask you some things regarding arithmetic. This is just to help me to see how your memory is doing or anything like that. If you can, I want you to subtract 3 from 20 and then just keep subtracting 3 from each new number all the way down. Okay?
Okay. 3 from 20 is 17. Minus 3 is 14. Minus 3 is 11. Minus 3 is 8. Minus 3 is 5. Minus 3 is 2.
Okay.
And then if I subtracted 3, it'd be minus 1.
That's good. That is correct. This would help also in seeing if decision making, judgment calls, stuff like that is good. Another thing you want to address on when you're assessing in the mental health is the speech of the patient. Now, I do want to state that you have situations where patients will have ill-fitting dentures, or they'll have problems with their mouth, and necessarily it's not just their teeth, it could be tongue related, the oral mucosa, so you have to take that in configuration. However, look at the resident, the patient, the clientele, see how they're speaking. Is their speech clear, or is it slurred? Are they positioned their mouth a certain way? Look at their attention span when you're speaking. For example, you could be talking to them about one thing. Will the attention span immediately change? This is good when you start in discussing different things. For example, I stated in between the questions you could discuss about different issues, whether it be sport related, personal problems, or whatever world issues. Many times you could see, is this attention span going to change? Is it going to waver a lot? The main thing of it is you want to keep the clientele as comfortable as possible with this. Make them feel like that this is not a huge exam or anything, but that you're here to try to help the patient. Now, when I was speaking with that, I would check to see, is he have a downward look? Is his eyes faced looking down? Or is he looking square at me? Good eye contact. Also, is there a disturbance in thought? Is something bothering him? And it doesn't necessarily have to be hallucinations or anything like that, which it could be. But you could see whether something underlying is going on. Is there depression going on? Any anxiety? Or it could be something family issue or work related. You're looking at this. This is the main thing dealing with mental health, because basically mental health is one key when you're opening the door to a patient's health assessment. Above all, when you assess a patient, always consider the patient's age. Try to, as best as you can with courtesy, to try to show the patient you're concerned about them, to try to improve their welfare. And this will conclude our mental health status in regarding to health assessment. Thank you very much.